Okay, so just like we've done with all the other joints in the body, we're going to talk about the kinematics. So because we have a lot of joints in the hand, there's a lot to talk about, and they're different. They're all different, as we've talked about a little bit in the last section. So the Carpometacarpal Joint of the thumb, or the CMC joint, motions occur primarily in 2 degrees of freedom. Abduction generally occur in the sagittal plane, 90 degrees rotated from abduction in every other place in the body, and flexion and extension generally occur in the frontal plane. Opposition and reposition of the thumb incorporate 2 primary planes of motion. So it's sort of like circumduction, where it's a combination motion, but it's a special motion that only occurs in the thumb. There's a little bit of rotation in the thumb, but it's not voluntary. It's incidental to the other movements. So with ab and adduction, in a neutral adduction position, the thumb lies in the plane of the hand. Maximum abduction positions the thumb metacarpal about 45 degrees anterior to the plane of the palm. And then full abduction forms a wide concave curvature useful for grasping objects. So there's our picture of our 45 degrees of abduction. Performing flexion and extension of the CMC joint is associated with various amounts of metacarpal spinning. So that's what I was talking about, the rotation that's not voluntary, but it happens as an accessory motion. So during flexion, the metacarpal rotates slightly medially, and during extension, the metacarpal rotates slightly laterally. It's just how it works. There aren't really muscles that do those motions, they just come along with those other motions. So axial rotation is evident by watching the change in orientation of the thumbnail between full extension and full flexion. So when I'm in full extension, my thumbnail is sort of pointing a little bit posterior lateral. And then when I'm in full flexion, my thumbnail is pointing directly inferiorly. So you can take a look at your thumbnail between full extension and full flexion and see if you can see the difference. In anatomical position, the CMC joint can be extended an additional 10 to 15 degrees, meaning you're taking your thumb farther away from your first finger. So from full extension, the thumb metacarpal flexes across the palm about 45 to 50 degrees. So lots of motion. That's a very functional motion. Opposition, the first thumb metacarpal abducts, and then the abducted metacarpal flexes and medially rotates across the palm towards the little finger. The muscle force helps guide and rotate the metacarpal to the extreme medial side of the articular surface of the trapezium. The little finger contributes indirectly by allowing the tip of the thumb to move and easily contact the tip of a small finger. One of the coordination tests that physical therapists will do a lot is touching your thumb to the tips of your fingers. Well, if you have joint restrictions, then you can't do that. It doesn't have anything to do with coordination. It has to do with the joints. The Metacarpophalangeal Joints, or MCP joints, are the knuckles of your fingers. Their articulations form between the convex heads of the metacarpals and the shallow concave proximal surfaces of the proximal phalanges. Motion at the MCP joint occurs predominantly in 2 planes, so they're condyloid joints. Flexion and extension in the sagittal plane and abduction in the frontal plane. The metacarpal phalangeal joints have joint capsules, connective tissue surrounding and stabilizing the joint. They have radial and ulnar collateral ligaments around each joint. They cross the MCP joints in an oblique palmar direction to limit abduction, and they become taut on flexion. We also have fibrous digital sheaths that form tunnels or pulleys for extrinsic finger flexor tendons. They contain synovial membranes inside to help lubrication. Because with all that motion we do in our fingers, we definitely need lubrication. We have some palmar plates in our MCP joints, or volar plates is the other name for them. And there wasn't a picture in the book, so I had to go out on the internet and find a picture. Basically, they're thick fibrocartilage ligaments crossing the palmar side of each MCP joint. And they really limit hyperextension of the MCP joint. So we can flex a lot. We can barely hyperextend at all. We also have deep transverse metacarpal ligaments that merge into a wide, flat structure that interconnects and loosely binds the 2nd through 5th metacarpal. So that's all pictured in this lovely picture that I found out there on the internet. There's a reference at the bottom of it, but you can barely read it. So for finger flexion, the motion is controlled by the flexor digitorum superficialis and the flexor digitorum profundus, and we'll talk about the relationship of those two muscles. Those 8 tendons that go out to each, 2 to each of the 4 fingers, those are the tendons that pass through the carpal tunnel. When we do finger flexion, it stretches and increases tension in the dorsal part of the capsule and the collateral ligaments, which stabilizes the joint in flexion. So a lot of the stability in our hand is guided towards a useful grasp. The kinematics of extension occur in the reverse direction. So we have roll and slide, roll and slide, roll and slide at the metacarpophalangeal joint and the interphalangeal joints. So the combination of grasp is a lot of different joints doing that roll and slide. In abduction, the proximal phalanx rolls and slides in the radial direction, so in the same direction because it's concave moving on convex. The kinematics of abduction of the MCP joints occurs in the reverse fashion. So radial collateral ligament becomes taut when we go in the radial direction, and the ulnar collateral ligament slackens. The thumb kinematics, active and passive motions of the metacarpophalangeal joint of the thumb are slightly less than the fingers. So most of our motion comes from the CMC joint. The MCP joint of the thumb has only 1 degree of freedom. It can only do flexion and extension within the frontal plane. It doesn't do ab and adduction. The motion that looks like ab and adduction of the thumb of the MCP joint is really of the CMC joint. So active abduction and adduction of the thumb MCP joint is limited, very limited, and it's considered an accessory motion of the CMC joint. So the interphalangeal joints, we have the pips and the dips, proximal interphalangeals and distal interphalangeals. The proximals are formed by the articulation between the heads of the proximal phalanges and the bases of the middle. The distal are formed by the articulation between the heads of the middle phalanges and the bases of the distal. So, and there's tons of little connective tissue, collateral ligaments within each of those itty bitty joints too. It's amazing how much stuff is crammed into our fingers. The articular surface of the interphalangeal joints has sort of like a tongue and groove articulation, and that helps limit motion at the pips and dips to flexion and extension only. So we want to not have too much motion in that area. Some of the ligaments that surround the MCP joints also surround the pips and the dips. So the pip and the dip kinematics, we have more motion in our ulnar digits for that grasping motion. So the similarities in joint structure cause roll and slide arthrokinematics at the pip and the dip joints. So we roll and slide in the same direction because it's concave moving on convex. Passive tension in the collateral ligaments remains constant throughout the range of motion. So our interphalangeal joints are made for stability in grasp. That is their point. The interphalangeal joint of the thumb, there's only one. It's limited to 1 degree of freedom, and active flexion only to about 70 degrees. So definitely less active flexion than the interphalangeal joints of the fingers. The IP joint of the thumb can be passively hyperextended beyond neutral to about 20 degrees. That's your hitchhiking motion. So our IP joints of our thumb were made for hitchhiking. Just kidding, but you can imagine it that way. This motion is often employed to apply force between the pad of the thumb and an object. So here's our caveman using his power grip on the a club, I'm going to say, and it's using a precision grip, a pad to side grip on a little chip of stone that maybe he's using to scrape a hide of the animal that he killed with the club. So this is a really functional caveman motion, but we can think of non-caveman. So I have these little plastic scrapers to scrape stuff off of my stoneware baking pans. And so I use that IP joint hyperextension to apply force to that plastic scraper. It's the same motion, but it's a functional motion, and we're using it for precision grips.